Hi, I'm Sam. We're starting a new YouTube channel called Stay Safe and Productive under COVID-19. Why are we doing this? Because it's very sad to see that many people in the West are getting the virus due to their lack of understanding on how to protect themselves. This kind of virus is new to most people in the West, and many confusing messages are circulated on various news media and social media. This makes it very hard for people to follow. As a result, many people in the West suffer or even die because of COVID-19. Some regions in the East, like Taiwan or Hong Kong, have much fewer people getting the disease. There are reasons behind. People in Hong Kong and Taiwan have learned a hard lesson 18 years ago, as they were the second and third places in the world that had the highest number of casualties due to SARS. Since COVID-19 is 80% similar to SARS, people in these two places are more aware of what they can do to protect themselves. As a Chinese Canadian who has spent many years in the West studying and working, and is currently working in Hong Kong, I would like to help by capturing the knowledge we've learned in the East and transfer this knowledge to those who may want such knowledge in the West. Today, I'd like to talk about an idea that is very popular in the West: social distancing. This is actually not a new idea. It has been well defined in a dictionary, a Western dictionary. People who got the virus may or may not display any symptoms, and social distancing is the practice of maintaining a physical distance from anyone who may or may not have contracted with the virus. UK government suggests that people should maintain a distance of at least 2 meters. US White House asks its citizens to keep a distance of 6 feet between people. The Australian government suggests citizens to stay 1.5 meters away from others where possible. Why is social distancing helpful to lower the chance for you to get the virus? First of all, people can catch coronavirus from others who have the virus. This happens when an infected person sneezes or coughs, sending tiny droplets into the air. This can land in the nose, mouth, or eyes of someone nearby or be breathed in. We should always be at a distance to anyone, because even though someone might not display any symptoms, he or she might have got the virus and can pass it on to you if he or she sneezes and you stand too close to him or her. Although the idea of social distancing is very important to keep us safe, many people are not practicing it, including President Trump and Vice President Pence in the US. This was captured on March 19, which I believe is quite a few days after the release of the guideline from the White House that asks its citizens to keep a distance of 6 feet between people. US President and Vice President are looked up and followed by millions of people around the world. And probably that's why so many people are also not practicing social distancing. This may be the reason why many people in the West are getting the virus. This general guideline on social distancing are helpful, but people still need to learn more to be safe. For example, say you are inside a lift with a few other people, and they are 1 meter or even 1.5 meters away from you. However, if one of these people inside the lift sneezes or coughs very badly, if the person has the virus, then you are still in danger if you don't have a mask on. Both governments in Taiwan and Hong Kong have issued statements regarding how wearing a mask can help protect its citizens from getting infected by others. Please be reminded that Taiwan has a population less than 1/3 of Italy, but the number of cases of getting the virus was less than 1%, that of Italy. WHO has a guideline that gives confusing ideas regarding whether healthy people should wear a mask. And US Surgeon General even asked people to stop buying masks. On March 19, Boston Globe published an article saying that though many sources, including many very famous newspapers and public health authorities, have advised people that masks are not necessary and should not be used by the general public for protection against the rapidly spreading virus, Boston Globe puts forward several ideas regarding why wearing a mask is advisable for avoiding getting COVID-19. First, wearing a mask works, and there's lots of evidence to support this. The coronavirus needs to enter through our nose or mouth. When you wear a mask, it just makes it very difficult for the virus to get inside you through your nose or mouth. Finally, the article mentions that as of March 17, the three places, Hong Kong, Taiwan, and Singapore, had fewer than 1,000 cases of the coronavirus, despite having close connection to China's Hubei province, where the epidemic originated and exploded late last year. There are many explanations for this success. Masks are used routinely by most people for protection against infectious disease in these places, and universal mask use is part of their coronavirus guidance. So when there are people near you, wearing a mask is always a good idea. Stay safe and productive. See you next time.